You know, a positive pregnancy test, it's one of the most recognized, most life-altering results in all of medicine. But what happens when that result pops up and there's no pregnancy? Okay, let's really get into this, because that simple line on a test can be the very first clue in a medical mystery that is way more complex than you'd think.
Yeah, you can just imagine the confusion, right? And the anxiety. A positive test for the pregnancy hormone, but you're not pregnant. How is that even possible? Today, we're going to unpack the science behind this exact puzzle, and we're basing it all on a fascinating review that maps out every single possibility.
So, first things first, let's meet our main player, human chorionic gonadotropin, or just hCG. This is the hormone that all those home pregnancy tests are looking for. In a normal pregnancy, the placenta starts pumping this out right after implantation, and the levels just skyrocket. That's what makes it the go-to marker for pregnancy. Simple enough, right? Well, hold that thought.
All right, so for our first section, let's start with situations where the test result itself is, well, it's basically misleading. The signal is there, but the source is not what you expect at all.
And here's culprit number one, phantom hCG. This is literally a ghost in the machine. It's not a real hormone that's actually in the person's body. Instead, it's a lab error. See, some people have these weird antibodies in their blood that can basically fool the lab equipment, tricking it into thinking hCG is there when it's not. It's a total false alarm generated by the test itself.
Now this is a really critical distinction to understand. On one hand, you have phantom hCG, which is just a lab glitch. But on the other hand, you have a biochemical pregnancy. That's a very real, though heartbreakingly brief, pregnancy that ends before anything can even be seen on an ultrasound. One is a technical error. The other is a true early miscarriage. And telling them apart is absolutely crucial for giving the right kind of care.
So moving on from lab errors, hCG can actually be introduced from the outside too. It's used legitimately in fertility treatments, for example, to help trigger ovulation. But it's also been used, let's say, less legitimately, in sketchy weight loss programs and even by athletes. And then in really rare psychiatric cases, like Munchausen syndrome, a person might even inject it themselves. So the point is, sometimes the hormone is real, but it didn't come from inside the body.
Okay, so we've covered errors and external stuff. Now, let's move on, because we're about to dive into an even crazier question. What if your own body is making hCG, but it has absolutely nothing to do with being pregnant?
Believe it or not, this is probably the most common reason for a non-pregnant positive hCG test. As women get into perimenopause and menopause, their estrogen levels naturally drop. And the pituitary gland in the brain, well, it responds by cranking out other hormones to try and wake up the ovaries. And guess what? One of those hormones is hCG. It's a completely normal, natural process.
And we're not talking about some super rare thing here. The research shows that up to 8% of women over 55 can have detectable levels of this pituitary hCG. That's a pretty significant number, and it's a key reason why a positive test in this age group needs to be handled really carefully, to avoid any unnecessary panic.
And the list of benign causes just keeps going. You've got rare genetic conditions, interference from certain medications, even problems with the liver or kidneys that stop the body from clearing out tiny amounts of hCG properly. You could even get a temporary positive from a blood transfusion if the blood donor happened to be pregnant. Wild, right?
So far, a lot of what we've talked about has been confusing, but ultimately harmless. But now, the tone of this whole investigation has to shift, because sometimes an unexpected hCG result is a serious warning sign. And this is exactly why every unexpected positive test has to be taken so seriously. If hCG levels are high, and especially if they keep rising in someone who isn't pregnant, it can actually be a biomarker produced by a tumor. It's the body's way of sending up a red flag that something is really wrong.
The most common group of cancers linked to hCG is called gestational trophoblastic disease, or GTD for short. This is basically a whole range of conditions that come from the very cells that would normally become the placenta. They can be precancerous, like what's called a molar pregnancy, or they can be full-blown cancers, and they all tend to produce a lot of hCG.
And wow, just look at this table. It really drives home just how versatile hCG can be as a tumor marker. It's not just about gynecological cancers. As you can see here, we're talking about tumors of the stomach, colon, lung, bladder, even breast and brain tumors can sometimes secrete hCG. It's a signal that can point to a problem almost anywhere in the body.
So,
With this huge range of possibilities, from lab mistakes to menopause to cancer, how on earth do clinicians figure it all out? Well, thankfully, there's a clear, systematic path they can follow to solve the puzzle.
It all starts by looking beyond just one test. The first step is always to get a quantitative blood test to see the exact level of hCG. But the real key, and this is so important, is the second step, tracking that number over time. Is it going down, staying flat, or is it rising? The trend tells the real story, not just a single snapshot.
And this table basically decodes that story for us. If the level is declining, okay, that often points to a resolved issue, like a miscarriage. If it's just kind of plateaued, just sitting there at a low level, that could suggest that normal pituitary hCG or maybe that phantom lab error we talked about. But if it's rising, especially if it's rising a lot, that is the biggest red flag, pointing towards a possible malignancy or an external source that needs to be tracked down right away.
So, we've gone down this whole rabbit hole, this whole complex diagnostic maze. But let's pull back for a second and focus on the most important question. Why does getting this right matter so much?
I mean, this quote from the research paper, it just says it all, doesn't it? A wrong turn in this kind of investigation can be absolutely devastating. Can you imagine being told you need chemotherapy for a persistent pregnancy that turns out to be just a lab glitch? Or just as bad, being told it's nothing to worry about when it's actually an early sign of cancer? The stakes are just incredibly high.
So I think the big takeaway here, the one thing to really remember is this. A single test result is rarely the whole story in medicine. It's a clue. It's the start of the investigation, not the end. It takes careful detective work, looking at the entire clinical picture to finally reach the right conclusion.
And it leaves you wondering, doesn't it? The hCG test is just a perfect example of this hidden complexity. It really makes you think, what other routine tests, the ones we all take for granted, are actually just the tip of a much deeper diagnostic iceberg?